Hi, I would like to ask a panel about the prevention, and we've talked earlier about preventative strategies, and you mentioned a couple of times today Lancet Commission, which identified the modifiable factors in dementia. We've talked about education, but I haven't heard much about education about brain health. And to what
about brain
education
health.
About brain health, and to what extent we're teaching younger generation about brain health. My son knows very little about brain health. He's 15, and he knows very little about whole foods.
I think the short answer is it is not existent in many.
Exactly.
Yeah.
And when we talk about huge bills that the European nations will be paying for not investing in brain health, I was just wondering to what extent the public health organizations at the EU level are doing anything to promote brain health, to educate populations, to know what it is. That dementia is not something that appears at 65. But basically your lifestyle in your 40s will lead you to your 65 symptoms of dementia. And I just, I think it's really, I think it's very urgent that we talk about brain health. Education is fine. We're all here today. We're super educated. We know what we're talking about. We absolutely understand where we are. But I don't think that even in this audience today, everybody knows enough about brain health. I don't know as much as I need to know. But I try to follow what is being promoted. I try to follow initiatives at the EU level, campaigns, but these are very, very hard to come by. Mm-hmm. The brain health is very much politicized. It's very much driven by pharmaceuticals. And we're talking about things that we're talking about a brain health disease, but brain health in itself, it could be very positive. We could be talking about neurogenesis, creating new brain cells if you exercise enough, if you eat well. We could be talking about neuroplasticity. At my age, I'm able to create new connections. So anyway,
yes,
my point was
I heard the beginning of the answer. So
I think
said that's my research.
We need more
so maybe you will have an answer here.
Brain health education. I think that's my message.
My research is the influence of exercise on the brain in mental illness. But I mean, education is maybe you want to
Yes,
say.
I think both of you. Huh?
No, I can only say that through the iGap initiative, many countries, all countries in Europe, are mandated to have at least one campaign in regards to a brain health aspect. For example, in Germany, I know that there will be a concussion day initiated by the young pediatrician, pediatric neurologists, to bring awareness of what concussion means in the long term for children, 5, 6, 10 years old. And I guess it's a slow process, but for example, looking at the United States, where my daughter lives and her son plays soccer without using the head, but he's not allowed to play football anymore because it's in the general consensus that football is bad for your brain. And that will change to some degree the sportive reality in the United States. I'm pretty sure. So there is slowly setting in that the brain, it's the most valuable organ you have, exactly, by far.
And it's just fascinating that people are not interested more. It's just why? We're interested in heart, in kidneys, in lungs, but when it comes to brain, it's just there is something there that should really have a public opinion survey to see what it is that's stopping us from.
If I can just answer this. Again, it's a question of education and culture. I think that it's said, and it's probably true, that the brain is the most complex object in the universe. If you explain that to children, they will start being interested in what is the brain. So the problem is not educating people about brain health. It's a question of interesting them to the object, the brain. And there have been some brain awareness, brain decade, for instance, in the US, to have people showing brains in schools, and then they will understand why brain health is important. The first thing is to have a cultural influence of them, not just providing data about how you should, what should be your diet. You need to do sport because I agree, it's true. And I already said that sport is important, but it's not giving new rules. We have enough rules. First thing is to increase the interest for the project and for the idea. And that's my guess for having a better approach of brain health in the population.